such a privilege to be here. My name is Negan. I'm not a clinical doctor, but I'm a public health specialist. I work in Surrey County Council. My current role is funded by the NIH, or National Health Institute for Health and Research. And I'm just here to talk about climate crisis from a health perspective, because that's what I'm interested in. So this has been taken from World Health Organization in terms of how climate change impacts our health as well. So the impact of climate change on our health can be in three different ways. So it can affect us directly or indirectly. So for example, in the UK, we know that we are particularly at high risk of flooding, extreme heat waves, and all of those actually impact our health from kind of causing some of the respiratory conditions such as asthma, heart disease, for example. But also, secondly, as the weather gets hotter, we start to see emergence of new viruses and bacteria that we didn't know about previously. So that from an infectious disease perspective, also that's really important. But also kind of some emergence of new animals. So you probably have heard of Lyme disease. That's become more prevalent kind of in somewhere like Surrey. But also, we haven't quite got there yet, but malaria, for example, that's kind of another threat that we are worried about, not just here yet in this country, but generally something that we need to be aware of. But also, thirdly, the climate change can affect our infrastructure. As we have experienced droughts, our crops fail. So the kind of provision of our local food provision is under threat, so risk of food insecurity, but also availability to drinking water. All of that obviously has an impact on our health from a physical and mental health perspective. People who experience flooding, obviously that affects their mental well-being as well as physical health. And also pressure on our infrastructure, on healthcare. So obviously all these kind of heat waves and so on that can affect our health. It will put pressure on our food system, but also on health and care services as well. But there are opportunities in terms that links health with climate change. And I have actually picked three areas. I know you heard about housing quite a lot, but I'm going to talk about transport, housing, and food, and how that kind of the climate change actually links with our health as well. So in terms of transport, actually transport is the largest greenhouse gas emitter in the UK. 20% of all of the kind of the greenhouse gases are attributed to transport. But I fully appreciate that obviously somewhere like Surrey's got rural, so we rely on cars quite a lot, and public transport is not, it can be better. But also, the more we drive, the less physical activity we do, so less walking we do, less running and so on. And if you look at the cost that kind of physical inactivity costs to our NHS and wider health and care, is about 7.4 million a year. So there's opportunity there as well. We talked a lot about air pollution, so obviously as a result of transport, causing excess death in the UK and costing us loads of money. But also, I think something that you picked on from a housing perspective, indoor air quality is also really important. So we always talk about air quality outside, but also inside our homes, which links to kind of some of the initiatives we were talking about, improving our housing conditions. So again, kind of just coming back to housing, obviously kind of less efficient homes are not obviously kind of causing the greenhouse gases, but also they're more costly to heat up. So in terms of fuel poverty, affecting about 13.4% of households in the UK. And we know the effect of cold homes on our health, again, from those who have got respiratory conditions, tend to be more affected. But also, again, during the summer, some people were experiencing really hot conditions inside the homes. Again, that kind of causes significant health issues as well. I talked about air quality, indoor air quality as well. So I guess it's kind of some of the key issues that we need to bear in mind. And then the food system. So some of the food that are harmful to the environment are also harmful to our health. Obviously, eating a balanced diet is really important, but we know that food that are high in fat, for example, cause heart disease, diabetes, and cancer. So I think there's something about, you know, how we eat, actually how it contributes to kind of reducing climate change as well. Actually, poor diet costs the society about 5.1 million nationally. So we talked a lot about legislation, policy in terms of what the kind of local councils can do. But if you think of climate actions as a layers of onion, actually all of us can play a part, from mitigation to adaptation. So at individual level, community level, local planning level, national policy, but also global actions. And I think I quite like the individual one, because at least we can feel that we are a bit of in control in terms of what we are doing. Our actions are actually making a contribution. But obviously, we all need collective actions for our policies to be effective. So some of the things, sustainable behaviors that we can do, and I'm sure all of you're converted that's why you're here. You know, from a public health perspective, you know, obviously being active, walking and cycling where possible is a great way for making our contribution towards climate change, but also improving our health and well-being. Again, kind of reducing waste and recycling is another way. And the way we eat, again, if you can eat more sustainably, kind of choosing the food products that are produced locally rather than kind of or out of season, again, that is good for the environment as well. We talked about improving homes, but again, that comes with barriers as well. And again, kind of supporting local businesses in terms of, and farmers to kind of to move more towards sustainable food systems as well. But I think when we talk about all of this, we have to think about vulnerable communities. So that, you know, some of the initiatives that we put in place are not reduce or increasing the inequalities that exist between our communities, because again, some people in our communities are better equipped to adopt these things or improve their homes, but there are others as well that are not, and we don't want them to miss out. I don't want to talk about this in great details, but in terms of our county council, we've got a health and wellbeing strategy as one of the key strands of health and wellbeing strategies as driven by county council, especially my team in public health, is climate change. And I don't know if you have heard of the wider determinants of health, which includes the environment that we live in. So not just the direct health, but also kind of other factors that can contribute to our health and well-being. To do that, again, this is really complicated, but this is just a screenshot of our strategic need assessment. So that's what we do to understand our population needs. And we look at kind of the data, both kind of from a numerical perspective, but also by engaging with our communities. And we use that data that we gather to shape the policies and so on. I think somebody at the beginning talked about you know, how data is actually used to inform how kind of the programs are delivered. Just briefly on health determinants research collaboration. So we are one of the 30 local authorities to have been successful in this program. The aim of this is how local authorities can be equipped so they can use data more cleverly by kind of working with the communities, so that the interventions that are put in place are evidence-based. One of the key aspects is actually our work streams is about inclusive public involvement and research. So we are ultimately looking for more people like yourselves to be involved in shaping or kind of developing our research project, or kind of actually in some instances doing that research, so we can gather the information that is not just presented in data statistics, but also from your perspective and your observation in the community and kind of experiences as well. So that's something that we are working on. Some of our approaches, as I said, is the kind of the public involvement panel that we are setting up, that you can get involved, or the kind of the wider public involvement network. So when we, for example, we want to do specific research around housing or transport or other areas, again, if you're interested, you can be invited to be involved in that research. And also the peer researcher program, which is about, I guess, you know, you can call them citizen ambassadors. So we kind of provide training to individuals such as yourself to be able to lead on a specific research project that is close to your heart, and that could be, you know, housing or anything related to climate and so on. So there are opportunities to get involved and help us gather that information and data that we need to be able to shape our policies a bit more effectively, and also just to make sure that some of the policies that are being developed are not top down, because sometimes we run a risk of leaving some communities behind if they haven't been involved. I think some people ask about how can I be consulted on some of the things. We want to take it a bit further. It's not just about consultation, it's about involvement and co-production with all of you. So, and I think kind of that research lens can enable us to do that a bit more, rather than just asking what you think. You can help us actually come up with the solutions as well. So if you are interested, this is our HDRC email address. So if you want to get in touch or find out a bit more, do let me know. Thank you very much.
Thank you.